The World Health Organization says dengue, a mosquito-borne illness, is surging worldwide because of climate change, along with social, environmental, and other factors, such as population growth and the globalization of travel, which facilitates the spread of the viral infection. On this week's episode of Health Options, we shall beam the spotlight on dengue following reported outbreak in Sokoto State. Stay with us for some enlightenment on the viral disease as we also interrogate measures in place to limit the risk of spread to other states. The removal of organs such as the kidneys, liver, heart, lungs, corneas, pancreas, and other body parts from living or dead persons connotes organ harvesting. Kidneys are the most commonly illegally harvested organs due to their high demand and survival rate. It should interest you to know what the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pati, has to say about illegally harvested kidneys. Welcome to the program. I am Rabi Abdullah. If you're just joining us, this is Health Options, the program that not only tracks government's policies on health, but helps you with the information you need to make informed choices about your health. We begin with the conversation on dengue.
Dengue fever is one of the mosquito-borne infections. When you are talking about mosquitoes, there is no mosquito that is absolutely safe. You talk about the common mosquitoes we have. One of them is the Anopheles that causes malaria. Then we talk about the Aedes aegypti that causes dengue fever, yellow fever, Zika, chikungunya, mayaro, and many other diseases. But these are not parasites like the mosquito. They are viral infection. And we also have another mosquito known as the Culex. This mosquito causes what we know as the lymphatic filariasis. So when you look at it, there is no mosquito that is just safe for human. And that is why whenever we are talking about mosquitoes, we target all of them.
Yes, dengue is a disease that is caused by a virus. It's called the dengue virus. And as way back as 2016, I can relate that I was part of the team that went to Sokoto, same Sokoto that is reporting incidents of dengue fever now. 2016, we are part of the team that conducted outbreak of febrile illness of unknown origin. So it was the lab confirmation that showed that yes, dengue was part of those diseases. Dengue, West Nile virus, Zika, and chikungunya, they are all arboviruses. So that is in brief what dengue is, and it's usually transmitted through the bite of infected mosquito. Till date, there is no human-to-human transmission of the virus. So you get infected when you are bitten by an infected mosquito, a particular mosquito called the Aedes mosquito. It's part of the family of yellow fever. So we're not surprised because we have mosquitoes around and diseases spread by mosquitoes. So we know which yellow fever is one of two. But dengue wasn't really something we're deliberately looking out for. So it was in the means of trying to really pinpoint what was actually happening, because it's actually a viral hemorrhagic disease, but not so classical of the ones we were expecting. So the lab had to really do more to really confirm that those other ones that are also causing such diseases are also checked be looked out for, and that was how we were able to get that. Yes.
Dengue fever, one of the common symptoms of these viral infections caused by Aedes aegypti is when you talk about chikungunya, you talk about the dengue. They is associated with bleeding. They also come with fever, feeling sick, but sometimes you may have bleeding. Although malaria too may lead to bleeding, the severe form, but commonly when you have dengue fever, apart from all these other symptoms, that fever, headache, and you know that it does not go with anti-malaria, and the fever associated with dengue fever is not intermittent. The fever comes and is there all the time, and the patient is very sick. So when you see an individual presenting with fever with some signs of bleeding, then you need to quickly report. And in Nigeria, dengue fever is a reportable disease. You report it immediately to your DSN officer, that is the notification officer in your area. Most viral infections, you don't just go and say, it's not unlike malaria where it's treatable, and once you take your normal treatment you get better. Dengue fever is not like that. You have to manage the individual conservatively. Up till now, there is no treatment that you say is available for the treatment of dengue fever. But the important thing is that you still need to report in the hospital and get managed. Take a lot of fluid, just like you do most other fevers. When you talk about the preventive measures, importantly, whatever you will do to prevent yourself being bitten by mosquitoes is a prevention. Most importantly, unlike when we talk about the malaria, we talk about the Anopheles mosquito. The Anopheles mosquito will most of the time bite in the night, but Aedes aegypti, they bite mostly during the day and also in the night. They bite in the day and they bite in the night. And not only that, when you allow the breeding sites of mosquitoes in your environment, gutters, flowing or stagnant water, or anything that will contain water in your environment that can breed mosquitoes, brings the disease close to you. So primarily, every mosquito should be a target for elimination in an environment. So whatever you can do to prevent the breeding of mosquito, you do. Most importantly, we promote the use of insecticide-treated nets. Let every individual sleep inside insecticide-treated net, but most importantly, children under 5 and pregnant women.
There is no particular definitive treatment for dengue. So the mainstay here is the vector control. Vector control is the main thing because it's caused by an infected mosquito. So preventing mosquito breeding ground should be one key important thing for preventing dengue fever, because it presents like any other fever illness. Fever is there with some symptoms that are not so specific that you could think is malaria or any of these fever illness. Fever is the main thing there. Have headaches, have body aches, It's not so specific per se, but such are the symptoms you get. And it's when you really have that index, you maybe must have treated malaria for the clinicians. They've done the basic things they're supposed to do. Malaria test negative. The fever is still not subsiding after paracetamol and anti-malaria. The fact that we are all saying this. So the next thing is to ensure that we we put up a definitive diagnosis to do the lab. So basically, those are the symptoms. They are not, they are just constitutional symptoms, I say. But in terms of prevention, I say the mainstay is vector control. First, some personal initiatives and the environmental component of it. Personal for individuals to wear proper clothing that covered or it should cover so that one is not exposed to mosquito bites. Also ensure sleeping under insecticide treated mosquito nets so that this mosquito don't have access to the body, or even use of repellent where appropriate, and ensuring we are seeing vector control. They breathe on dirty areas, stagnant water, so it's to ensure sanitation, proper sanitation of the environment where we live, so that we don't have this stagnation of water and the lights that favors breeding of this mosquito. And most importantly, is to call the hotlines. The NCDC hotlines are available, 6232, and the relevant designated hotlines within the state ministries of health or within the states across Nigeria, so that we ensure that these affected persons are taken promptly to the hospital and the diagnosis is made promptly and the required supportive treatment is given promptly. We are very aware that, yes, because we've been working with the state government and the team, a PIT team, that yes, dengue has hit Sokoto since November. As of today, we have 72 cases, suspected cases, and 14 lab confirmed, all within Sokoto State. Primarily 3 local governments, Sokoto South, Dengue, and Wamako local governments, areas of Sokoto State. So those are the places where getting, and primarily affecting the young age group, 21 to 40 age group. Those are the ones primarily. And this local government primarily, mostly in the urban and the semi-urban areas of the local government. So it's actually a disease of the, if you want to call it, the urban slum. I can recall way back that 2016 that we responded to similar thing. It was actually around densely populated area of Sokoto State. Sokoto South was one of these local governments, I recall. Yeah, so as we said, we've been responding to Sokoto and NCDC as a public health institute. We have all the public health systems, processes, and infrastructure in place to actually diagnose and respond to dengue fever, which we've been doing in collaboration with the Sokoto State government. Let me give kudos to Sokoto because it's a good, we are happy and we are so proud that at least they are able to really respond to this outbreak. Though we've been communicating, providing the needed off-site support. Well, I tell you, a lot of response activities has been taking place by the state government in collaboration with relevant partners. Sensitization of clinicians, people managing these cases has already happened, and it's still ongoing. Webinars, we can attest to that, has been happening in Sokoto by the Sokoto state governments and the clinicians there, trying to really create that awareness, because it's not something that is primarily like the malaria we see every time and treat. You need to have an index of suspicion to be able to do that. So what has been happening is raising that awareness for clinicians to be able to have that index of suspicion, to make it as part of their differential diagnosis in dealing with such febrile illnesses. So that webinar has been happening. And in collaboration with the malaria control program in Sokoto State, we see a lot of fumigation activities ongoing to really, and even the the State Ministry of Environment, we saw how sanitation activities have been ongoing to ensure sanitation is enforced, so that the breeding grounds for the dengue vector is actually prevented. So a lot of activities have been happening. But for us in NCDC, as we speak, We have activated the Incident Coordination Center, that's the ICC. Currently, we are what we call in the alert mode. The alert means to be on the watch, strengthen your response control activities in terms of case detection, looking out for these cases and ensuring they are promptly managed. We're trying to do that with the state, government. So, and there is what we call the Incident Action Plan. This is a plan of the response and plan activities that we intend to roll out to ensure the dengue fever is brought to the various minimum. It's brought to control. So that has also happened. Again, at the national level, we have almost finalized what we call the case definition. The standard case definition for dengue, because you have to come up with a standardized nomenclature so that if it happens in Bauchi, if it happens in Bayelsa, if it happens in Kwara, you know it's dengue. So that uniformity in nomenclature, in what are the symptoms, what it is that once you see it anywhere is dengue. So that's what we call the case definition. That we are almost finalizing because it's something we have to have a collaborative agreement on that. We've done that, and again, for our risk communication, the corporate you could see that we have sent public health advisory to even media houses. I'm sure they are one of that, and to the public. In terms of the case management, again, it's a continuous thing. We are trying to ensure we have a nationwide awareness creation among the clinicians in terms of sensitizing them to be able to do the needful whenever they see such signs and symptoms. And the infection prevention and control mechanism, for us in NCDC, this is so robust, and we have that plan within the health care facilities across the country with the training packages ready to onboard clinicians for this. So that has been institutionalized across the health facilities nationwide. So that's something we're proud of. And in terms of the research, because it's a vector disease, so we have the National Arbovirus and Vector Institute that we're collaborating with, because you need to conduct research to learn more, to better understand how this disease vector operates, so that will inform your interventions and control measures. Because we know a lot of evolving of these diseases, some of them are emerging, some of them are re-emerging. It's something we've not been having them so often. So it's a lot of learnings that we are supposed to be doing, so that it will inform whatever we're going to be doing by evidence, not just hearsay or what we think we should do. But just so to say, so far, out of the cases we have recorded, we have not recorded a severe dengue case and no deaths for now. As I said, the risk of outbreak as we speak is on the moderate level. We call it, that's why we are on the alert. Our risk score is for us to be on the alert. So that but I'll tell you, the RRT trained rapid response team are already part of what we're doing. They're on standby. Whenever we have this nationwide outbreak, that is, they cannot curtail. Definitely these people are mobilized to really go out there to support. They are on standby.
So, keep the mosquitoes at bay as much as possible. Organ harvesting, especially that of kidney, has become a source of concern in this part of the world. Check out what the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pati, has to say about the ugly phenomenon.
Organ harvesting or selling one's organ is illegal. It's illegal as initiated in the National Health Act 2014, Section 51 to 56, which makes it blatantly illegal for anyone to sell his or her organ, or for anyone to procure and to exchange payment for someone's organs. We got the report from the journalists that investigated the case in Maraba, and as a ministry, we reflected on what the law provides. There is a provision in the law for a fine of all to ₦1 million or imprisonment of at least 2 years or both for anyone who sells his or her organ or who procures his or her organ. Transplantation is a medical procedure. It should be conducted by certified health professionals, and there's a procedure laid by law and by the guidelines that the ministry has provided, where there has to be informed consent. There has to be a committee that certifies who is eligible and who can be able to do such transplant procedures. Now, anyone that does transplantation outside this legal framework is committing an illegality. It's also very wicked. And we really feel for those who are victims of this unfortunate practice, which is in a small portion of our society, and we don't condone it. In addition, we've empowered our regulatory bodies, the Medical and Dental Council of Nigeria, to investigate, particularly the hospitals that were mentioned in the investigative reporting, so that we confirm and take the appropriate steps in conformity with the laws and regulation. We're very committed to strengthen the regulatory framework where health is delivered to Nigerians that is at high quality, that protects and safeguards their basic rights and doesn't contravene the laws of our country. So it is illegal and we don't accept it, and we're ramping up our regulatory function to ensure that the victims of such practices are basically protected and restituted. I believe that that is something that Nigerians will see. If anyone has information about such practices or their approach to sell or to transact in organs, there is a number that the Federal Ministry of Health has set out, which is 080-33228978, which Nigerians can call and alert us, and our healthcare regulators will act on it. It's an illegality that we should not condone, and no civilized society will accept that practice, and we don't accept it.
That does it on Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of this and other episodes of the program. My name is Rabi Abdullah. Be good and stay safe.